Families taking care of special needs kids, specifically those with medically complex issues. They're looking closely at legislation they say leaves them with few caregiving options. The state Medicaid agency is still on the hook for answers tonight.
Yeah, News 8's government reporter Garrett Berquist has been following this for more than a week now. He brings us the story of one family now scrambling for alternatives. Garrett.
You all right?
Several times a day, Bethany Johnson has to clear her son Landon's lungs.
His muscle tone doesn't allow him to cough anymore. So this is a machine that simulates a cough form. It blows air into his lungs and then it sucks it back out to clear any mucus that he might have.
Landon is 15 and has severe spinal muscular atrophy. About the only movement he can make is to blink for yes and no. Bethany has to care for him 24 hours a day.
It's hard to know his needs if you don't spend a lot of time with him, because it's just like anybody else. You learn their preferences, you learn what they like, you learn what they don't like, and he certainly has preferences just like everybody else.
The FSSA pays Johnson for 70 hours a week of care through its attendant care program for legally responsible individuals.
It's just given us a little bit of a padding to where we don't have to be concerned if emergencies come up, flat tires happen, car trouble happens.
She'll lose that padding on July 1st. The Family and Social Services Administration says it's shutting down the program to help close a $900 million funding gap. Her husband works full-time, but she says it's barely enough to cover her family's needs.
I really struggled the first couple of days. I really struggled. I was depressed because I was thinking, what are we going to do? How are we going to readjust our lives to go back to barely making it?
Families have begun protesting at the State House. During a conference call with the FSSA on Monday, lawmakers said they're frustrated by the answers they've gotten so far.
I've been waiting for 11 days to get numbers. I mean, I would think that before FSSA decided to take these specific steps, there would have been numbers about how many individuals would be impacted and how much it would cost, how much it would save. So where is the data?
I can't personally speak to that. What I can tell you is that we're continuing to work to pull together information, to share it publicly.
The FSSA has proposed an alternative program that would pay by day rather than by hour. Johnson says that wouldn't nearly meet her and Landon's needs. She says skilled nursing or in-home care aren't good options either.
It's a situation where we have a new nurse. She knows nothing of Landon. I have to train her all by myself. So how do I miss work while that's happening, even if I did have a nurse? Or let's say that nurse's family is sick. She can't come in immediately. I can't come in.
Johnson and her husband are checking every expense they have to see where they can save money. She says if the FSSA needs to cut costs, it shouldn't do so at the expense of the most vulnerable.
I think that we need to take a step back and say, hold on, who will this affect? How will it affect? Will lives be lost? And I think there's a real possibility that lives could be lost if this goes through due to lack of care.
The FSSA is taking public comment on the idea until February 16th. It's not accepting any new families, but anyone who is already on the program will continue to receive benefits until July 1st. In Jackson County, I'm Garrett Bergquist for Wish TV, wishtv.com, or follow us on Facebook for more updates.